Now summing it up. Where are we now in the diagnosis of pulmonary hypertension? Well, the definition has been revised and includes more patients. That includes patients with mean pressures of more than 20. Those patients with high pressures and normal left-sided filling pressures with high PVR meet the criteria for pre-capillary disease. This definition has included more patients, but we have to decide how that impacts management. We now have a new group of patients that meet criteria for disease, but do not yet meet criteria for treatment in our previous studies. So we have a lot of work to do. So let's fast forward here. We're in 2020. What do we know? So we know that diagnosis is key. We need to suspect, evaluate, and diagnose. And then we need to risk assess. Regular risk assessment is important for proper diagnostics and reevaluation. We base our treatment on how ill the patient is, and then we adjust treatment as we monitor them. Currently available risk scoring provides similar predictive measures on patient morbidity and mortality at time zero and going forward. It is key that PAH treatment is tailored for improving risk rather than maintaining status quo. Using risk scoring, especially in early disease, in our high-risk patients will help us improve our ability to treat them aggressively enough to impact their outcome. And we know that there's new things out there, new diagnostic tools, but we need to develop them and improve them further to be more efficient and effective in our diagnosis. So in summary, the World Symposium met in early 2018 and prepared a new consensus recommendations for the definition, diagnosis, and treatment of pulmonary hypertension. This reflects a change in how we view pulmonary hypertension. A mean of greater than 20 is 2 times more the upper limit of normal. These patients have increased risk of morbidity, mortality, and decreased exercise capacity. They did also, in addition to the change in definition, made the categories or the classes, the groups, more simplified, so we can more easily approach that. And because of this hemodynamic definition change, we've had to change our diagnostic approach. We need to uncover disease earlier and then look at that group and try to discern how best to evaluate and manage. Thank you so much for joining me.